GLP-1s right now, for
Mhm.
instance, hot topic. I recently had a conversation of, well, what happens when they work so well that a patient is no longer diabetic? Services or
Mhm.
order the same lab test just to get more money, get
Mhm.
reimbursed for that. And so that
Mhm.
doesn't really seem right because you're not actually delivering better care. You're just subjecting the patient to more and more services, needs, tests, whatever it might be.
Yeah. Hi, welcome to the Margin Emotive Podcast. I'm Jason Lee. We are part of our series for the DeCal Future of Healthcare lecture series. I'm excited to welcome longtime friend and colleague Jenni Bendfeldt to the show.
Thanks, Jason. Happy to be here.
So, Jenni Bendfeldt, for those of you in the audience, is joining us at the neighborhood today. She's a powerhouse in the healthcare community. She's the founder of her own healthcare consulting firm called Recast Health. She delivers on helping organizations fill that space and deliver for under resource populations, quality focused, the space between providers and payers. And today we're going to be diving a little bit into how she balances that margin between healthcare IT space and the motive of delivering quality care for patients. And so, Jenni, again, welcome to the show.
Thank you.
So, for those of you in the audience that haven't met Jenni, I will tell you it's a treat to have her on today. Jenni and I have been longtime friends and colleagues. We've met, golly, at least 10 or 15 years ago as colleagues at a consulting firm. Geez, what do you remember from those days? That was quite a long time ago.
I remember we used to have to trek out to Walnut Creek before we convinced them to move the office to San Francisco. But we had a lot of fun times. In the office and then some of the social events where we were the two powerhouses, if you will, when it came to cooking.
Absolutely, absolutely. That's right. That's
Yep.
right.
Yep.
Uh, Golly, there was that one scavenger hunt we did together. That was pretty fun, traipsing all over San Francisco and
Yep.
finding all sorts of things.
Yep.
And who could forget the barbecues,
The
right?
barbecues, winning the gingerbread competitions. We set the bar really, really, really high with your Red Vines Golden Gate Bridge.
Absolutely, absolutely. And if you ever want to satisfy that sweet tooth, you got to have Jenni's pecan pie, award winning.
Love
So
it.
fantastic, fantastic. Well, so thinking about some of those things, Jenni, one of the things I do remember is the early years of the Future of Healthcare the Future of Healthcare lecture series, DeCal
Mhm.
series here at UC Berkeley. You and I got a chance to co-speak
Mhm.
in one of those early sessions. Do you remember what we talked about?
I do, and I still remember putting together that very first slide deck where we're talking about what's the difference between healthcare and every other industry, and we're like, it's you got the providers, the payers, and the patients. It's not as simple as your producer, consumer, supply, demand type of situation. So
Mm-hmm.
I think that was really helpful to be able to set the stage for the rest of the lecture series. And I think, are you still using that slide today?
Golly, there are a couple that I still do use. Yes, absolutely, because I think it's important to inform and educate the students, particularly the undergrads, about how that industry is so different, how we as a healthcare industry are so different than the normal consumer industry or manufacturing or any other type of industry. And so setting that foundation and understanding foundation, I think, is important. And we'll talk a little bit more today about how you're also giving them some insights into that payer-provider relationship also.
Mhm,
But before we dive too much into that, I do recall some of the early discussions, the early lectures that we gave, how much fun we had, and giving the students an opportunity to test out some of their business ideas. Do you remember? Are there any that stick in your mind about your favorite business idea at all from over the
So
years?
many good ones. I will say that as this class has continued to evolve, the ideas just keep getting better and better each year. The whole concept of like continuous improvement, that actually holds true for this
Mm-hmm.
class as well as all other aspects of healthcare. So it's just been really exciting to see how students, capture different insights from different speakers and how they apply it. And there's been a few times where I'm like, that was something I specifically mentioned. So it's kind of cool to see how can plant seeds during your lecture and then somebody
Right.
really resonates with that.
Yeah, putting those ideas into their heads, giving them something to glom onto, and then producing something that eventually could turn into some actual viable business opportunities. So that certainly has been fantastic. And for me, seeing the students understand the business a little bit better, and we get to have a breadth of students that are interested in the clinical aspect of healthcare and the business aspect of healthcare, and then the startup technology aspect of healthcare. Those are all very interesting elements of the industry that we have spent, golly, 20 some odd years in as an industry. So
Yep. Yep. Yeah. I think one of my favorite parts about being involved with this lecture series is every 6 months or so, it forces me to do a little bit of reflection
yeah,
and think about how has my career evolved? What's different? And I got to say, what I thought I would be doing when I was an undergrad grad student, never imagined I'd be sitting here today doing what I've done. So it's fun to just plant seeds or give people inspiration that they can pave their own way.
hmm
And there are so many opportunities out there to make a difference in healthcare. It might not be obvious, but we're
right,
giving them exposure to what could be. So
right,
that's
right.
really exciting.
Well, and for the audience, why don't you dive a little bit into your past history? Tell us one or two of your favorite highlights from your career, or pivot points from your career.
Yeah, so I actually started off as a dietitian,
Okay.
working at a hospital in Nebraska. That's where I'm from, grew up on a farm, and then decided that I maybe don't want to be a clinician once I started taking my first business classes and getting my master's in healthcare administration.
hmm
So my first job out of grad school was implementing electronic health records.
Oh boy.
And at the time, I'm like, I'm not a techie. What is this? But the trick wasn't actually being able to code or really understanding the technology behind it, but it was
Right.
figuring out how to apply it in a meaningful way. And so
hmm
I've really made a career out of figuring out how to use people,
hmm
processes, and tools
Okay.
to be able to deliver better care. And so being that go between technology vendors and the
hmm
end users and understanding what questions to ask has been really exciting, and it
hmm
gives you an opportunity to learn a whole lot about different areas of healthcare and find solutions to problems that plague the workforce. So
Yeah.
we know that technology, when implemented the wrong way, can lead to physician burnout. It can lead to patient errors. I mean, there's so many things that can go wrong if the tools aren't providing the right data to the right people at the right time. And
hmm
so getting that right up front and being proactive has been kind of my forte and
Yeah.
something that I've somehow managed to spin out into a career and a consulting career, and it's continued to grow. So there's just a need to be able to, solve the problems for the people that are doing the work,
hmm
and making sure the technology can be successful as well.
Yeah. Yeah.
Mhm.
And so you mentioned you started as a dietitian, obviously clinical support and one of the allied health professionals in
Mhm.
driving care out there
Mhm.
in the community. Was there a particular inciting incident that said, "Hey, you know what? I want to move a little bit more into the administrative side," or not, or was it a gradual evolution?
I mean, I think I realized that it would be hard to be a clinician,
Mm-hmm.
and I saw all these bright people just wanting to help patients, and
Mm-hmm.
I thought, rather than fixing one patient at a time, why don't I try to fix the system and make the end providers and the people that are actually providing frontline care their
Mm-hmm.
jobs easier?
Mm-hmm.
And so therein lies, okay, I could have more of an impact and do more good
Yeah.
by making the technology, automation, and again, getting the right information to the right
Mm-hmm.
people to improve care.
Yeah, yeah. Well, and I think that is something we all are striving for in the healthcare industry. Something that I think, whether it's technology or operations improvement or what have you, folks really put a lot of time and effort and brain power into.
Mhm.
So as you have then evolved, obviously you spent some time as a consultant, and now you're sort of independent as an independent consultant. But you also spent some time working at some health systems
Mhm.
here along the way. Compare and contrast a little bit. What are some of the key differences that you found, whether it's working with a whole cadre of team members versus a smaller consulting team, or somebody that is actually deploying and delivering something versus advising and creating strategies. Like compare and contrast that a little bit, and give me some insights into how you've thought about that over the years.
Yeah, so I think when I worked at a big consulting firm, we were doing things on a much broader scale,
hmm
and there was kind of a drive to systematize things and have it be each project be something that can be replicatable, because
Right.
that's how you develop white papers. That's how you develop subject matter expertise. So when I went independent, it was less about doing things the way that firm and encouraged and more about really getting in and understanding the nuances that are driving that particular customer's needs.
Mm-hmm.
And so now a lot of my work is in the safety net space
Okay. Of
where you've got more complexities and more problems, less money too.
course.
And so being able to make a really big impact with just a little bit of time or a little bit of insights is really fulfilling. So I
Mm-hmm.
really like that.
Mm-hmm.
And then really focusing on where there's shifts in regulations and policies.
Mm-hmm.
And a lot of that's happening right now, but and then following the potential implications that that's going to have on the key players to healthcare. So how is a new regulation going to impact
Right.
the payers? How's it going to impact the providers? How about the patients?
Mm-hmm.
What are the barriers that are going to need to be addressed in order to be compliant with these regulations? And so
Mm-hmm.
that's kind of the policy front. And then you've got the whole reimbursement side of it too,
Mm-hmm.
which is always shifting. So how can we get the right kind of structure in place? Who needs to be trained? Like where is the change management need to come in order to be successful?
Yeah, yeah. No, and I remember, gosh, years ago when there weren't quite as many really high-powered search tools as there are these days, and having to find the final rule,
Yeah.
print it out, read the whole thing, 500 pages,
Yeah.
try to identify the couple of sentences that might impact
Mm.
a policy or a reimbursement that a customer or a client might find value in. And so I know that, boy, times really have changed. Have you taken advantage of some AI to push some policy documents or final rules into
Absolutely.
AI and summarize that stuff for the?
Absolutely. I
Yeah,
built a custom GPT that we use for I mean it understands all the work we've done. It understands some of the key policies. And so it's a lot easier to be able to say, "Hey,
yeah,
what from this do I need to be mindful of for XYZ?" And so I think today if you're not using AI as a thought partner,
yeah,
you're really missing out
yeah,
and you're spending time doing things that you probably.
yeah. No, I hear you. I hear you. Well, fantastic. I want to ask you a little bit about the class,
Mhm.
but before we do, we'll take a quick break and we'll dive into the lecture a little bit.
Sounds great.
All right.
Perfect.
So we're back talking with Jenni a little bit about the Future of Healthcare class. Great lecture series. I know you and I have been part of it for many years, giving students here at UC Berkeley a glimpse into lots of different aspects of the healthcare industry. I know I talk about a certain area around finance and whatnot. Why don't you tell us a little bit about where you focus on for the students and what you would love for all of them to take away from class in your session particularly?
Yeah, sure. So I talk in general about transformation, how
Mhm.
to work with existing players in the healthcare industry, whether it's a provider organization, whether it's maybe a community-based organization, a
Mhm.
payer,
Mhm.
um, digital health tools. I mean, there's a lot of people and a lot of different types of organizations
Yeah.
that play a critical role in the delivery of healthcare.
Mhm.
So at its highest level, it's transformation. But I've given a similar kind of lecture for many years and it's evolved. And one of the things that came out of more recent years was the request to learn a little bit more of like, what is it like to be a healthcare consultant? And so it can mean a lot of different things.
Mm.
And so I spend some time just talking about how a consultant can be an objective third party
Mhm.
has specific expertise who can come in and help customers figure out something that they maybe don't have the time to figure out
Mhm.
or the expertise or do the political nature of it. So if,
Yeah.
if the consultant has
Be the bad person in, as it were.
correct,
Yeah, right.
correct, yeah, and then you um, share expertise, learn from other types of customers who face similar problems.
Mhm.
And so, when it comes down to it, it's solving problems and knowing how to solve it. So you don't always have to have like direct subject matter expertise for the area they hire you to.
Right.
You can figure it out pretty quickly, but it's more about the process of bringing people along
Mhm.
for the
Mhm.
transformation and just understanding how the inner workings of a healthcare organization um, are kind of strung together and maybe who the decision makers are.
No, and I think that's an interesting point. And as I think about, if I put myself in the shoes of the students, and I'm hearing you say, look, the transformation piece is one of the most important things. Whether it's changing a process, changing a technology platform, changing a clinic location, what
Mhm.
have you. There could be 100 different things that could be transforming, and they
Yep.
don't all have to be technological.
Yep.
As the students are asking you questions and you're giving them advice about managing some of that change,
Mm.
what are 2 or 3 key checkpoints that you're thinking about, that you're looking for as you yourself are in the middle of managing that change?
I just think about data. I think
Yeah.
about data a lot and data strategy. So, particularly when it comes to being able to demonstrate return on investment or the
Mm.
impact of the change, we've got to
Mhm.
think about what data is available. What are the sources? How
Mhm.
is it going to be shared? Is it accurate? And so kind of thinking from a data visualization, like who has what information and how does it need to be shared. So I do a lot of kind of data strategy just from that particular piece of it.
Okay.
Which also, you mentioned you talk about reimbursement. Data's key to reimbursement, right? And
Mhm.
there's so many
Mhm.
different types of reimbursement models out there. And I do like that you always go ahead of me
Uh,
in the lecture series so the students can have a little bit of a foundation to understand the pathways from reimbursement that exists.
right.
So then when I come in, I talk about the data, but I also talk about quality and quality improvement.
Mhm.
And there is this shift towards value-based care
Mhm.
where it's, less about getting paid for service and demonstrating overall value. Well, how do you demonstrate the value? You need the data that's
Yeah.
associated with quality measures. So I spent some time talking about that and just general kind of quality improvement methodologies and what it takes to actually drive successful change in these
Yeah.
organizations.
Now, for some audience members that might not be as familiar with some of the terminology that you use,
Yep.
as we think about quality and quality metrics in the context that you're using it,
Hmm.
what do folks look for? What are some of the actual metrics that you're pinpointing as you're
Hmm.
evaluating that data validity?
Yeah. So, I mean, I think it depends on the population. So, when you're looking at value based care contracts, you can write in certain types of quality indicators that you want to look at. But
Hmm.
generally, there's this concept of HEDIS. So, the NCQA is this national quality forum, and they put out these
Hmm.
metrics to be able to manage how effective care is.
Uh huh.
So, there's some measures that you're going to see very frequently. So, chronic disease management measures around like
Absolutely.
controlling high blood pressure, or if you've
Right.
got a patient that has diabetes, managing their hemoglobin A1C.
Hmm.
When you're looking at pediatric population, getting kiddos in for wellness visits, making
Hmm.
sure that they're getting the developmental screenings that they need at the right time.
Yeah.
So it's a combination of disease management with preventative measures that
Hmm.
ultimately can lead to better outcomes. And so, depending on the measure, it requires different types of data to be
Hmm.
captured. Now, some
Hmm.
of that data might be sent through like a claim when you're just doing billing, but a lot of it exists elsewhere. So,
Right.
what a lot of my work is around is identifying the data sources and
Okay.
trying to create the pathways using technology and data sharing to get the information about those measures to the right people, namely the payers, to be
Hmm.
able to count. So, um,
And the thinking and capturing all of this and recording all of this, it sounds like, and again, you know, a lot of folks that aren't in the healthcare industry may not understand and grasp some of these concepts, but the notion is that we're keeping people well. Is the notion that we're just monitoring how well their diets are? Like,
mhm.
what are some of the reasons and rationale behind some of the metrics and key measures that you come across?
Yeah. So, I mean, I think if you tie it back to like reimbursement structures or like the motives of it.
Yeah.
So, if you have your typical fee for service, you might be incentivized to see more patients and deliver more services or
Mm-hmm.
order the same lab test just to get more money, get
Mm-hmm.
reimbursed for that. And so that
Mm-hmm.
doesn't really seem right because you're not actually delivering better care. You're just subjecting the patient to more and more services, needs, tests, whatever it might be.
Got it.
But if you did like a capitated or like DR, like diagnostic related grouping, things
Mm-hmm.
you would get paid a certain amount for the per member per month, and then you're incentivized to the providers are incentivized to not necessarily order as much because if they can get deliver care for that patient,
Mm-hmm.
and so say they get like $100 a month, making this up, And if you can deliver care for less than $100 a month, that's money in their pocket. So then you're
Right.
withholding care. And that doesn't really seem right either. So with the whole idea of value-based care, you're paying more for better outcomes.
Mm-hmm.
And so how do you know better outcomes if they exist? Well, you have to measure it by these defined quality measures.
Mm-hmm.
And so getting the right data is key to that. And people have been talking about value-based care in the healthcare industry for a long time.
Yeah, long time. Even before the Affordable Care Act in 2010, it was a topic on the tongues of many leaders.
Yeah, and the challenge was always there's not the right kind of infrastructure in place to deliver on that.
Yeah.
And so we're getting a much closer to that
Mm-hmm.
with EHRs and interoperability standards. And when I say interoperability standards, that's just making sure all organizations are using the same language when sharing data.
Yeah.
So value-based care is much closer than it has been, but you still have to have the right kind of infrastructure in place.
Mm-hmm. Mm-hmm.
And that takes not just tools, but changing the way that people operate. So
Yeah.
that's where, again, the people, processes, tools all come into play.
Now, I wonder if over the last 10 years that we've been doing
Mhm.
some form of this lecture, if you find that the students are more or less skilled or experienced with some of the data elements. I'm thinking back 10 years ago when technology was less advanced, both in the healthcare industry and also publicly available to students and folks that might not have some database experience. But now I feel like a lot of the students are much more well-versed in crunching data and experienced in database management software and those sorts of things. And so as you think back over the years, have the questions and have the discussion gotten more sophisticated with the students?
Yeah, absolutely. Yeah, and I think too, there's been a lot more from an investment standpoint into
Mm-hmm.
healthcare and digital health.
Mm-hmm.
And so I think back to when we first started, wasn't a whole lot of money being poured in
Mm-hmm.
to digital health technology. And then around 2015, 2016, 2017, it really
Right.
started taking off. And
Right.
then
High
during
Tech Act you're thinking of. Yeah,
exactly.
yeah,
And
yeah.
then during the pandemic, everybody was trying to come up with innovative solutions. So it again started to take off, but now we've got enough data to look back and say, did those investments pan out? And in a lot
Mm-hmm.
of cases, no.
Mm.
And why? Well, I think it wasn't because it wasn't a good idea or wasn't a good product, but
Mm-hmm.
where I think a lot of digital health startups have fallen down is implementing it the right way.
Mm-hmm.
And so that's another kind of part of the work that I do. And I will talk about this a little bit in my lecture too,
Uh-huh.
of the importance of making sure that solutions are implemented appropriately, got the right kind of transformation happening.
Right, right. Well, and so, thinking about the bright-eyed audience that we often get with these students, what's the one thing that you say, hey, you know what? After today's discussion, I really want you to take away this. It could be a question, it could be an
Mhm.
inspiration, it could be a perspective. What's the
Mhm.
one thing that you like the students to take away from your discussion?
Yeah, so I always mention the data, follow the data, and
Yeah.
think long and hard about your solutions. And is it going to actually make a difference for the right people?
Mm-hmm.
And is it something that um, is truly unique, or is it something that's just kind of a different
Mm-hmm.
spin on something that
Derivative,
exists?
sure.
Right. And so really encourage the students to do their homework and their research
Mm-hmm.
when it comes to pitching their final project. And I think that has certainly gotten better over the years.
Yeah, for sure. For
Mhm.
sure. So, obviously, during the discussion, you're giving the folks, the students, a perspective on data and interoperability and a lot of the things that we touched on. But you're also giving them perspective on career advancement and growth.
Mhm.
As you talked about, being a consultant is something that you have woven into your speech or your lecture a little bit. Tell us a little bit more about how that strikes the audience, and then also tell us a little bit more about what you've been up to more recently, some of the projects that you're tackling these days, and what's on the minds of a lot of the clients that you work with.
Yeah. So one piece of advice that I like to share is um, think about what you're good at. So
Mm,
my whole career, I again didn't think being a healthcare consultant was even a job, or
mm-hmm,
being an
mm-hmm,
entrepreneur startup. Did not know this position existed, and so being able to kind of pay my own way has been really enlightening. So the advice that I give the students is pay attention to the things that you're good at.
mm,
So if you find that you're your friends, like, you're really good at XYZ. Don't expect that there is a job out there that is going to be perfectly aligned for the
Mhm.
things that not only you're good at, but you enjoy
Mhm.
doing,
Mm.
but look for opportunities to apply that skills and expertise. So for me, I really liked working with people and tools and solving problems.
Right.
And so it's a different kind of consulting than a lot of people do, but it fits me. And so that transformation aspect of it just fits me and what I like to do. And
Mhm.
so that's the advice for the students is just, think about what makes you happy and find ways to kind of your own career to the extent possible because then it's not going to feel like work. It's going to
Right.
feel like your passion
Yeah.
and it's going to be exciting.
A little bit of flavor of love what you do and you'll never work a day in your life kind of
Exactly.
perspective. Yeah.
Exactly.
And I think one of the challenges that I often hear when I'm mentoring students and when I talk to folks in class and whatnot is a lot of the uncertainty, of course.
Hmm.
You're in school, you're training. What's going to happen with AI vis-a-vis a lot of roles? What's going to happen in the technology? A lot of folks entered school over the last 5, 6, 7 years thinking, oh, I'm going to go into some time technology role. And a lot of that is getting shaken up in a snow globe and disrupted by a lot of what's happening. Um,
Hmm.
there's to say nothing of some of the other uncertainties in the world that are causing chaos in the job market. Certainly, I could see how there'd be a lot of questions about how do you pursue, how do you find the right pathway for yourself. Um, but I would agree. I think having some passion for what you do
Hmm.
really will help.
Hmm.
Certainly, everybody wants to make a living and make $1 million if you can, but having a passion for what you do will really help to lighten the burden of that task and
Hmm.
those activities that you've got for sure.
Yeah, and I do talk a bit about AI in my my lecture series tonight. So
Hmm.
one of the things I think is really really important when thinking about AI is the use cases. Like how is this technology being used? And AI could mean I think at this point it's more like automation than
Hmm.
true AI intelligence
Hmm.
because healthcare is so complex. You're never going to actually remove it together.
Yeah.
But the things that are repeatable
Hmm.
and
Hmm.
have a lower risk, those are the activities that you want to be able to use technology. So, for instance, making outreach calls to a patient to remind them of an appointment. You don't need a human doing that. You can send a text
Yeah.
message, you can have calls. So then you're freeing up the humans to do the things only humans can do,
Right.
talking with the patient. So the more that we can allow clinicians to be clinicians and patients to be patients and
Hmm.
remove the awkward laptop
Yeah.
from in between it, I think that's actually going to be much better. So just getting smart about how you can use technology
Yeah.
to extend the existing workforce is where the future is going to be.
And like we always used to say, focus on the top of the people's functional license, right?
Exactly.
And so we know that healthcare, there's multiple tiers. You've got allied health professionals, you've got advanced practice
Hmm.
practitioners, you've got physicians, and you've got a whole array of office staff that are supporting all of those folks. And
Hmm.
so I think that rings true. And I agree. I see automation coming in a lot of places. I
Hmm.
see a lot of organizations trying out different AI technologies and whatnot. Are there any trends that when you talk to your clients, when you talk to folks out there, leaders of medical clinics or entire ambulatory enterprises and whatnot, what are some of the things that they're checking in on, asking you about? What are they afraid of or what are they concerned about in the next couple of years that you're hearing about?
Yeah, I mean, I guess on the AI front, I'll start there. I mean, trends that I'm seeing is more around like administrative activities. So
Mhm.
less about like clinical decision support. While that does exist, it's more about building trust with using AI tools. So starting with administrative activities to figure
Mhm.
out how to operationalize that is a good kind of way to inch towards more automation. And as we know, there is a provider shortage. And that's going to be not just a nice to have, it's essential that we need to start being able to create a more efficient workforce of clinicians, physicians to be able to address the needs of our population.
Yeah.
So I think that's part of the what I'm being asked about. But then it's also well, how do we actually go about doing that? What does this system do? So when I say system, I'm talking about electronic health records and how
Mhm.
they interplay with some of the tools that the insurance companies or the payers use to process claims,
Mhm.
to be able to calculate quality performance.
Mhm.
So that interplay between systems is another thing I'm often asked about,
Okay.
to build the proper pipelines of data flow, if you will,
Yeah.
and ensure that folks are trained up to use the systems in the right way.
Are folks looking more? I've heard out on there. I've talked to some folks in the audience and whatnot. Folks are looking for single stack solutions, even if it's 80% as good as maybe the ideal point
Mhm.
solution. That because it's integrated in single stack, that makes it a little more appealing. Are you coming across any of that
Ye
or?
Yeah, I am, but it depends. So if you look at, like, Kaiser, for instance, everybody thinks of them as, one of the gold standards for an integrated
Yeah.
solution, and they have Epic, but they have other tools too.
Mm-hmm.
And so
Mm-hmm.
you're never gonna get to a fully integrated stack solution,
Yeah.
but figuring out how to make the pieces play effectively
Mm-hmm.
is where it's going. In particular, healthcare is not just happening in a hospital or at the doctor's office. It's happening all throughout the community.
Mm-hmm.
So that's the other challenge I'm seeing a lot is how do we start to integrate these community-based organizations, for instance, like a food bank
Mm-hmm.
or somebody that's helping with housing because we know
Mm-hmm.
social determinants of health have a
Mm.
really big impact.
Right.
So it's impossible to have a single stack solution that's going to address all facets of healthcare.
Mm-hmm.
um, so trying to get those kind of ancillary players that impact health but have never really been part of the formal healthcare system and bringing them in
Yep.
has also been a new challenge that I've been working with, but it's been exciting as well.
Yeah. Yeah. And I think what you're also kind of getting at is that um, healthcare delivery is so local, is so different depending on the setting and all the pieces that you're talking about,
Mhm,
the mix of providers that you have, the mix of facilities that you have, the
mhm,
coverage, insurance coverages that various folks have, rural, urban, et cetera,
mhm.
maybe even international healthcare, right? And so you
Yeah.
think about all of those elements that are kind of going into the stew can really change the needs
Mhm.
of each individual, not just clinician, but the entities, those health systems that are
Mhm.
delivering care. They're going to have different needs, and their stack is going to look very different, I think.
Absolutely, because patients they serve are different.
Yeah.
Not everybody's the same. So there is a lot of focus on rural
Hmm.
access to healthcare in rural communities, and
Yeah.
there's some really big grant funding opportunities that exist. But healthcare is way different in rural Nebraska, where I'm from,
Yeah.
than it is downtown San Francisco. And
Right.
so being able to understand the nuances and ask the right questions
Hmm.
is key to finding what solution is going to work best for that particular.
Yeah. Yeah. Well, and so just a final question before we move on to some other topics is, what's the most interesting thing that you're working on right now, project wise? Do you have one or two that you're just like, wow, this is like super, this has been super fun to work on, and I really enjoy the team that I work with, and
Yeah,
tell us
so
about that.
I more recently, I've been doing a lot of work with managed care plans
Hmm.
and bridging the gap between managed care plans and federally qualified health centers.
Okay.
But using that experience and knowing the problems that exist today, I'm parlaying that to doing a little bit more work advising digital health startups, which when I initially started
Okay.
Recast Health, I thought I would do more of that kind of work.
Yeah.
But now it's a lot easier for startups to build a product with the use of AI engineers.
Sure.
And so there's a lot more products looking for the market fit. And
Okay.
so I'm starting to do a lot more work with digital health startups that have solutions
Got
to
it.
solve the gaps that I'm uncovering through my other clients. So I'm just really
Any
excited about
any
that.
promising ones that you can tell us a little bit about?
There's
No.
a lot of promising ones
All
right
right.
now. But I think a lot of the ones that I'm really excited about are focused on the Medicaid population
Yeah.
because they're really getting hit hard right now, and so it's
Hmm.
going to take some really creative, innovative solutions to be able to address the future of that population.
Yeah, yeah. No, fantastic, fantastic. All right, well, let's take a quick break and we'll be right back. Well, so we're back talking with Jenni. Jenni, you remember a little while ago we were sitting there talking about, golly, wouldn't it be interesting that healthcare needs some interesting voices, some different
Mhm.
stories? There's a lot of news going on about like what is newsworthy in healthcare,
Mhm.
and there's a lot of focus on technology too. But we felt like, golly, what there. there could be a space for some interesting stories, some interesting interviews, some interesting discussions, right?
Yeah, yeah, absolutely. So it was at the JP Morgan Healthcare Conference when we, kind of finalized some of the details. And I mean, everybody's riding high at that event. You've got a
Sure.
lot of investors, a lot of ambitious people trying to fix healthcare. But the problem with some of that is they don't necessarily understand it and they don't
That's right.
necessarily understand the economics of it. So, creating this podcast is an opportunity to help educate some of the people that are kind of dabbling in the healthcare space, but don't necessarily understand why healthcare is so broken.
Yes.
And so, to
That's right.
bring a little clarity to it, this podcast exists, which I'm really impressed by how quickly you put this all together
Appreciate
and,
that. Yeah.
captured some really great speakers. So I'm just honored to be a part of it. But I do think to your point, there's sometimes misaligned incentives.
Mhm.
There is just actual structural reasons why organizations aren't able to do what they would like to do.
Mhm.
And so, kind of peeling back the layers of the onion and understanding one, what you have to do to keep your doors open from the margin perspective,
Mhm.
and then also the motives or the incentives or like why an organization might do something. And oftentimes it's also opaque because healthcare is a complex industry and it's not just supply demand producer consumer as we talked about earlier. It's
Yeah.
very complex, so you need to get alignment across multiple key stakeholders
Yeah.
in order to actually make it function.
Yeah, no, and I think that's I mean, that's where we landed, boy, but I remember we were talking about it, and, I was thinking what was I thinking about? Some technology angles
Hmm.
and thinking about, maybe a pure leadership, like, how do you lead physicians kind of
Hmm.
angle, and I said, "But I just don't feel like that's a good way to draw in and to help inform, folks that are interested in the healthcare industry." Do you remember what you said? You should really think about this one word, do you remember that
Yeah, yeah,
conversation?
yeah, yeah,
Yeah.
yeah. That was.
Yeah, you said, "Oh, I think you should think about incentives of
Hmm.
why people are doing things," you
Yep.
know? And, I think it's a truism that, everybody in healthcare has slightly different incentives,
Mhm.
whether you're a provider, a technologist, an administrator, a health plan. I mean,
Mhm.
and, all of those folks could still be working with the same person.
Mhm.
The same our auntie or our dad or our sister or our brother,
Mhm.
are all being touched by 5 or 6 different people that have
Mhm.
different incentives, motivations, and interests. And so,
Mhm.
so that was really intriguing for me, and I appreciate you contributing to the development and brainstorming of the concept here.
Mhm.
As you think about ways that we can really touch some of the audiences.
Mhm.
What's a topic or two you think we should dive into in the future in coming episodes?
I mean, there's so many different perspectives. I mean, I personally always like the data and the transformation piece, but
Absolutely.
digging into the people, I think is also really interesting. And I mean, we're mostly talking about like the delivery side of healthcare or the payment of healthcare, but there is a
Hmm.
lot of really cool stuff happening in life sciences, biotech,
Right.
and how some of those like truly innovative solutions can impact the way then care is delivered. So if I mean, there's telemedicine, but there's also like GLP-1s right now, for
Hmm.
instance, hot topic. I recently had a conversation of, well, what happens when they work so well that a patient is no longer diabetic?
That's right.
And so, kind of tying all the pieces of innovation together and then thinking about the future of healthcare and
Hmm.
and what's going to need to shift is, I think, makes sense. So I don't know, keep doing what you're doing,
Yeah.
but just with that forward thinking framework of, how things might shift once this happens.
Yeah. Yeah. Well, and I think the folks that we're talking to as part of the Future of Healthcare series is a good start. I know we've got some physicians, we've got some nutritionists, we've got some pharmacists, et cetera, that can give us good perspectives on how the different parties are approaching healthcare.
Mhm.
What the motivations of those folks might be, what the tactical margins that they're tackling would be, and so
Mhm.
so I really appreciate both you being a brainstorming partner on that and
Mhm.
also joining us today for today's discussion.
Yeah. Well, thank
Yeah,
you. It's been a pleasure.
yeah,
Appreciate it.
yeah. So Jenny, I want to thank you for coming on today. Been a great discussion. We talked a little bit about both the genesis of this podcast and how far back we go, and also more about how you are bringing insight to the students about change management, about transformation, and really helping them along their career path to give them some insight into where they can go, what they can do in their next steps. Um, and finally, just thinking about what's hot and what you've been working on in healthcare, and some of the really interesting challenges that the Medicaid population and the FQHC population are struggling with, and how you're bringing some really innovative ideas and technologies to those organizations, whether that's directly working with those clinicians or bringing digital health solutions to those entities as well. So, really interesting conversation today. And if you or anybody else out there is interested in hearing more conversations like this, more folks that are part of the Future of Healthcare series, please subscribe to Margin and Motive, and like us out there on the different socials, and appreciate your listening today. So, Jenny, thank you so much for coming on.